بسم الله الرحمن الرحيم. Executive Management Team, delegates of the Health Promotion Directorate and Ministry of Health, delegates of the Bahrain Free Labor Union Federations, Al-Hur, ladies and gentlemen, good afternoon. On behalf of our President, Mr. Yasser on behalf of our CEO, Mr. Yasser Al-Abbasi, I would like to welcome you all to this cancer awareness presentation. Cancer is one of the major health problems in the Kingdom of Bahrain. It is the second leading cause of death after cardiovascular diseases, accounting for 12% of annually reported deaths. It inflicts the substantial burden on healthcare services, consuming a large proportion of financial and other resources. Once the cancer is detected in the early stages, then the chances of a cure is very high. I would like to welcome Ms. Sarah Al-Naimi, Deputy Chairman for Occupational Health and Safety in the Bahrain Free Labor Unions Federation, Al-Hur, to the stage. Please help me in welcoming Sarah.
Assalamu alaikum. Good afternoon, everybody. I would like to thank Dr. Mohammed Salim for his cooperation. I would like to thank everyone in GPIC company, especially also the labor of GPIC employees. In our federation, we have an occupational health and safety committee that is actually taking care of employees and the delegates labor unions inside the companies that are under our umbrella. As we are concerned all, since we are working in industrial companies, it is a must for us to take care of you, all of you, whether if you are in management levels or labor levels inside the company. And this month in February, we have the awareness of cancer. So I would like to thank also Ministry of Health, especially our team in our health promotion. So I would like to welcome Dr. Mohammed Khamis to present you the lecture about the cancer awareness. I hope whatever information that you get in this lecture to be distributed to your colleagues amongst your team, your sections, or even your other departments. Thank you very much for welcoming us.
Hi. This is Dr. Mohammed Khamis, and today I'm going to talk about the cancer, one of the most important topic that must be in consideration for each person. Okay, first of all, what is cancer? Actually, cancer is a disease that affects the enhancing cells and lead to abnormal growth and multiplication. As we can see in this photo, this is the normal cells that is normally growth with the normal function, and this is the cancerous cells that is growth abnormally and lead to abnormal function. Actually, cancer is caused by multiple risk factors, and also there is lead causes of cancer. Also, the cells lose their original function and turn into harmful cells that destroy the nearby health cells. Okay. Also, the cancer can be start from one organ, and then it metastasis or it spread to the another organ through the blood and lymph vessels. Also, the cancer is non-contagious disease, so that it's not can be transmit from one person to another person. Actually, we have many types of cancers. As we can see, there is most common cancer for men, like lung cancer, colon cancer, prostate cancer, and bladder cancer. This is the most common cancer in men. Here, the most common types of cancer that is commonly seen in women, like breast cancer, colon cancer, lung cancer, thyroid cancer, and finally, ovarian cancer. As we can see here, there is multiple risk factors and many risk factors that may affect the cancer. First of all, the age and gender. Okay, some types of cancer that is increased in a specific age, in general, as long as you increase in the age, the chance of cancer it becomes increased. So we have also the unhealthy diet, such as increased intake of high-fat food, like fast food. Also the low intake of fruits and vegetables, low intake of high-fiber foods. Here, the obesity and lack of exercise. Also smoking, especially related to the lung cancer. We have alcohol consumption, also related to liver and pancreas cancer. Hereditary factor, like genetic factors. One of the most important things that must be considered. Also the past history of cancer. Also, there is a physical factors like carcinogenic factors, like ultraviolet light, ionizing rays, and exposure to the sunlight for long periods of times, especially without protective, like sun protective cream. We have also the chemical agents like asbestos and ingredients of tobacco smoke. Aflatoxin, which is a food contaminant. And finally, we have the arsenic, which is a pollutant in drinking water. We have the infections with certain viruses, especially the AIDS virus, and hepatitis B virus, human papillomavirus, which is most commonly related to the skin cancer. Okay, so what is the symptoms of cancer? We have many symptoms of cancer, and also this is not a confirmed diagnosis for cancer. This is maybe a red flag to check up and make the confirmation by many investigation. First of all, we have the fatigue. Also unexplained weight loss, which is involuntary weight loss without any special diet or without heavy exercise. We have the fever and night sweats, skin changes such as viable mole changes or lumps, changes in bowel habits such as constipation and diarrhea, especially for the colon cancer. We have persistent cough related to the lung cancer, and constant pain in the joint and muscles of the body, because sometimes some types of cancer that may metastasis to the bones. So we can have like a bone cancer. So there is abnormal growth in the bones and lead to constant pain. Also abnormal secretions or bleeding. So these are the red flags of cancer. We can if any of these symptoms present in any case, we can consider the cancer and make the confirmation investigation to confirm what is the disease. Okay, how can we prevent cancer? Actually, we can prevent cancer by the previous risk factors, to avoid any previous risk factors and prevent cancer. So first of all, eat a healthy diet. Also be physically active. Refrain from the smoking and alcohol, and maintain the healthy weight. These are the most important prevention methods to avoid any types of cancer. Also, we have managed stress and get enough sleep and rest, screening and early detection, which will be our next topic, and avoid prolonged sun exposure, and vaccination against some infection disease. So, early detection of cancer prevention. The best way to prevent is early detection, because early detection of any cancer, like in the early stage, it will be curable and it will be easily resectable by surgery. And also some types of cancer, no need for any chemical or radiological therapy. Okay. There are early detection programs for some cancers in the Kingdom of Bahrain, such as breast cancer, prostate cancer, and colon cancer, finally cervical cancer. Here in our program in Kingdom of Bahrain, we have the breast cancer. First method for screening, which is breast self-examination, starting from age 20 years and above. They can monthly checked for self-examination. It is an easy way. There is many sources to learn how to self-examination. There is in YouTube some videos. Also the clinical examination. Clinical examination, woman from age 25 to 39. And we can repeat it every 1 to 3 years in any health center. We have also a woman aged 40 and above annually. We can do this clinical examination. And finally, we have the mammogram, a woman 40 years of age and older. Every 2 years, we can do the mammogram. For the cervical cancer, woman from 21 years of age and older. And we have the National Colorectal Cancer Screening Campaign for both women and men between ages of 45 and 75 years. Finally, we have the prostate cancer screening for the men, 50 years of age or older. As we can see cure rates for some types of cancer, such as breast cancer, cervical cancer, oral cancer, and colorectal cancer, increase when they are detected in the early stage and treated. Actually, we have many types of treatment for the cancer in general. First of all, we have the initial treatment. Initial treatment, we can see many options. First option we can consider, which is surgical treatment to remove the cancer cells, especially in the early stage. We have supportive treatment to destroy the remaining cancer cells after the initial treatment, such as chemotherapy, radiotherapy, stem cell transport, and biological treatment. And finally, we have the hormonal treatment or hormonal therapy for specific types of cancer, especially the cervical cancer and the endometrial cancer. And finally, we have the palliative treatment, usually related to the advanced stage of cancer, which is some types of cancer, it will be non-resectable. We can't treat it like surgically. So palliative treatment, it aims to relieve the symptoms caused by cancer rather than cure them, to help the patient to live more comfortable life, to alleviate the physical and psychological, social, and spiritual problems in more than 20% of the patients with advanced stage cancer. So, in conclusion, the screening, one of the most important topic or the home message to take for you. Screening is very important, as we can see in the Kingdom of Bahrain program. And you can consult your family physician in the health center to start your screening. Depends on your age. so that you can avoid any type of cancer or to prevent any cancer. And finally, thank you. I would like to thank the health promotion team and GBIC company for this opportunity. And I'm welcome for any questions.